Hello, good morning. Hello, good morning. Thank you for joining. I hope you're doing well from wherever you are joining. Today it's our Info Day for 2024. Last year we were here together with you. You were online. We were here informing you about the 2023 work program. Today we'll be talking about the 2024. Just a bit of history. As you all remember, we are belonging to what we refer to now as Global Health EDCTP3. This is a third program after the EDCTP2 and the EDCTP1, which started back in the days in 2003. And now we are a joint undertaking, which is between the Commission and the EDCTP Association. It is our third year of implementation. We've launched calls in 2022 and 2023. We just opened our calls for 2024. Today we'll be talking about those 7 calls specifically, but you'll have also the opportunity to hear about legal issues, requirements for being eligible for funding. But it is also an opportunity for you probably to have a feeling of what is in for the applicants before you take your time, before you form your teams and write proposals, to know what is applying to your research themes in the institutions where you're working from. But it's also a moment to look at what you've invested in. We invest money, invest your time and knowledge. It's time to look at what you've done before under EDCTP 1 or 2 and see together with us in line with our strategy to see where you can align, where you can maybe help us deliver products, bring products to the market, build capacity in Sub-Saharan Africa. But it's also, I'm just taking these few minutes to remind you that this third program has expanded in terms of scope. So you'll see that today we're going to present some of the topics that you are not used to see in EDCTP2. That includes, for example, AMR, that includes digital issues. That is also looking at vector control, for example, for some of the diseases. This is made possible by the increasing budget. It's a program which is receiving a contribution from the Commission, which is about 800 million. Participating states in the association, similar contribution, but also an increased contribution from third partners that we're looking for constantly, but also partners who could come from you, the researchers, because you do have your own funding streams, or you are supported by your national programs, or other collaborators you may have. Those too can come and collaborate with us. But before taking a long time introducing this program, I would like to invite my director, Dr. Michael Makanga, through a video which will be sent to this studio from where he has recorded it. It is a video which will remind you again of where we come from and what is in for you this year. Thank you.
Dear colleagues, partners, researchers and innovators, welcome to our 2024 Work Program Info Day. You're joining us today means you have unity in purpose with the Global Health EDCTP3 to reduce the burden of infectious diseases in Sub-Saharan Africa and globally. With a total budget of 1.6 billion, this iteration of the EDCTP program is already working to deliver new solutions to tackle infectious diseases and to strengthen research-based capacity for preparedness and response. To maximize the impact of the partnership, Global Health EDCTP3 focuses on strategically critical areas of unmet medical need. Our annual calls for proposals reflect specific current research needs for target diseases and research capacity development. With over 230 million euros in funding, the 2022 and the 2023 work programs addressed several key aspects of our strategic research and innovation agenda. Projects working to develop diagnostics, vaccines and treatment to tackle diseases such as HIV/AIDS, malaria, TB, or Lassa fever are underway, as well as projects working to strengthen ethics and regulatory capacity, genomic epidemiology, and to increase the number of skilled infectious disease personnel working in Sub-Saharan Africa to strengthen preparedness and response capacities. In 2024, 140 million will be dispersed through 7 different funding schemes. Specifically, these will support activities aimed at tackling malaria, HIV/AIDS, neglected tropical diseases, along with a broader set of infectious diseases through a core topic on vector control and the growing threat of antimicrobial resistance. the current calls also aim to capitalize on the rapid advancements in the digitalization and unprecedented opportunities created by digital health services to improve prevention, detection, and treatment of infectious diseases. Moreover, training of researchers will also be sought, in particular through collaboration with industry partners. Importantly, all projects funded under the Global Health EDCTP3 support South-South and South-North collaboration. This is key to promote and encourage sharing of knowledge between researchers, private and public stakeholders, profit and non-profit partners, so as to speed up the development of new and improved health interventions to tackle infectious diseases. Moreover, we'll continue to synergize and coordinate with other existing African and European health and research programs to ensure our funding has a maximum impact and that our results are translated into concrete policy outcomes. During today's Info Day, you'll learn more about 2024 calls for proposals, as well as important eligibility criteria and other matters, and will be able to ask us any question and seek clarification where needed. Our hope is that this session will prove useful when preparing research proposals. We look forward to receiving high-quality proposals as we seek to deliver new and improved interventions against infectious diseases through excellent science. I thank you all for joining this event.
Thank you. That was Dr. Michael Makanga. And now just allow me a few seconds to introduce the speakers who are together with me in the studio and those who are online. I'm joined today by Laurent Schell, our legal officer, but also with Lydia Bodaren from the scientific team in Global Health EDCTP3. Online, we should be joined by Jan Peller from the European Commission and Michelle Singh from the EDCTP Association Cape Town office. Before delaying further, I'll pass the word to my colleague, Laurent, who's going to talk about eligibility requirements, but also explain a bit the procedures on how to become contributing partners to our programs. Over to you, Laurent.
Thank you, Jean-Marie. Good morning, dear community. So I will try to explain you a bit what you should expect as requirements when you submit a proposal and what you will have to include in your projects, and also, of course, who can participate and who can receive funding, which is something you all want to know, I suppose. And then later, contributing partners. I will explain you a bit what these contributing partners are, why, and what they can do for the joint undertaking. And okay. So when it comes to eligibility for participation and funding, in principle, any entity can participate from anywhere in the world. There are a few restrictions at the moment with entities from Russia, but this is not really in scope with our partnership, which is really EU-Africa focused. So participation is in principle not limited. However, when it comes to funding, this is in principle only available for entities that are located in EU member states, associated countries to Horizon Europe, and any sub-Saharan country that is member of the EDCTP Association. On this last point, you will see that the list can evolve. There were new countries joining the association last year. Our colleagues from the association will tell you more about this, but to be up to date, we invite you to look at the website of the EDCTP Association, where you find the list of the countries that are members, and these are automatically, entities located there are automatically eligible for funding. There is something new as of 24. The United Kingdom entities are also eligible for funding of the joint undertaking, excuse me, since the United Kingdom joined the Horizon Europe program as from this year. So this is also something new, and there will be no transitional measures as in the last calls that you had to go through. When it comes to the composition of a consortium, there are a few requirements. So in general, we need at least 3 organizations, part of the consortium, that are in different countries. And these countries all have to be a part of this eligibility for funding list. So in short, for example, you can have an entity from Germany, one from Uganda, and one from South Africa. And this is, for example, possible because all these three countries are eligible and when it comes to funding. In addition, there must be, in any case, always one entity that is located in a member state of the European Union or in an associated country, and also at least one that is located in a sub-Saharan country, member of the EDCTP association. So this is standard for all our projects, at least in this 24 work program. This is true whenever, in any type of project. It's true for research and innovation actions. It's also true for the coordination and support action. So this is standard. These are standard conditions. Now you may have noticed that under our work program, because of our funding regulation, there are a few restrictions about what organizations can act as coordinators of the project. And this, in short, is only restricted to EU countries, associated countries, and in practice, South Africa. But to also allow that at least the scientific leadership can be taken can remain in Africa, there is a requirement for a scientific project leader to be assigned to each project whenever the coordinator is not based in South Africa. So in short, the coordination remains with the coordinator, especially when it comes to all financial aspects. However, in these cases, when you have a scientific project leadership, the idea is that this organization acts alongside the coordinator and coordinates, in fact, the project with the coordinator when it comes to scientific matters. And this includes, for example, providing input as to the assessment of deliverables, the reports. So this is what we have in the indicative list we provide in the work program. It can be discussed within the consortium. It is really up to each consortium to discuss how the tasks are allocated and coordinated between the coordinator and the scientific project leader. But the idea is that the latter, the scientific project leader, is always deeply involved in all the scientific management of the project. Concretely, when it comes to your proposal and later the annexes to your grant agreement, you will have a requirement to include a work package on scientific project leadership. So traditionally, you will have a work package about coordination. And there, in addition, you need one on scientific project leadership, and you will explain in short how the two organizations work together. Also, this comes, of course, with cost eligible. Whatever work has to be done by the scientific project leader in terms of coordination, scientifically speaking, are eligible also under the project. There is also something a bit original maybe for the newcomers in the course of our JU. We also have a provision in our funding regulation that requires that products and services that are developed on the basis of clinical trials that are funded by our projects have to be available, accessible, and affordable to the public. And this is translated concretely in our work program with additional exploitation obligations. And in particular, we require for most of the projects that the consortia include a stewardship plan and a global access plan as deliverables. So these will be assessed as part of the package of all deliverables in our project. We can, of course, discuss the exact content, but yes, the idea is that whenever a product or a service may be developed afterwards, you need to have a plan to make sure that it will be accessible, affordable, and available to the public. I think I did something wrong. My apologies. Could we go back to the slides? Thank you very much. Now the contributing partners. So you may have noticed that in our funding regulation, there is some budget allocated for contributing partners, contributions, and this is connected to potentially additional budget for the joint undertaking. In short, when a contributing partner gives €1 to the JU, one way or another, I will explain this to you a bit later, the joint undertaking can also spend an extra $1 million, and this triggers extra budget. So who are contributing partners generally? We can have any type of organization that is not related to the joint undertaking's members. So in short, we can have philanthropies, we can have any university, we can have companies such as pharma companies and so on. Even third countries are not involved in a joint undertaking. All these entities can be involved as contributing partner. Of course, the idea is that we have a very deep synergy behind. So contributing partners can suggest areas in which there is a common interest with the ones of the JU, and see how we can work together and collaborate quite deeply. These contributing partners can provide either financial or in-kind contributions to projects. This means concretely, to put it short, that if it's a financial contribution, this financial contribution in most cases would be a transfer of funds to the joint undertaking under certain conditions, of course, for example, funding a specific topic, part of our work program, in which case we would discuss with the contributing partner the content of the topic. And another option, for example, is to participate in the project for the contributing partner. And in this case, it's possible either to do some work under the project, but without being reimbursed, or at least not fully, by the joint undertaking, unlike other beneficiaries. And all the costs that are incurred by this contributing partner that are not reimbursed would become the in-kind contribution. It is also possible within a project that the contributing partner, in addition, transfers funds to other beneficiaries of that same project, and this could also be counted as a financial contribution. But overall, this is the idea that, yes, there is a contribution to the actions, to the projects of the joint undertaking, and then we can, as a little carrot, free some funds for the joint undertaking as well, and fund ourselves more projects. So as I said, if there is a topic in which a contributing partner is involved, the idea is, of course, that it is discussed jointly with a joint undertaking. This is something to see in detail, case by case, but originally this is the idea, that we co-build a topic against the contributions that we receive. More funds. You may have noticed, so we have a 400 million budget potentially to match contribution of the contributing partners. So this is, of course, a large chunk of the joint undertaking's budget. So we strongly encourage any organization interested to reach out to us and to discuss how we can work together to make this joint undertaking even more successful. Concretely, indeed, I invite you to contact us, to contact the Secretariat, to discuss any possible plans, and ultimately we would discuss the content of a letter of endorsement, which would be sent to the governing board, and the governing board would then approve, if everything is agreeable to all parties, this letter of endorsement. And this letter of endorsement is to include the area of research in which the collaboration will take place, with more or less specifics depending on the case, but we can also be specific about the type of topic, the type of research exactly that would be funded. This letter would need to include also the amounts of the contribution that are planned, and potentially other modalities. So I can already announce slightly in advance that very soon we will publish some guidance on our website, and this will include a template for the letter of endorsement. So this is coming shortly, probably in the very next weeks. You will have news from us on that point, and this will probably help you to understand how to get involved. But in any case, we're always available to discuss any practicalities. And I will now pass the floor back to Jean-Marie, who with Lydia will talk to you about the calls for proposal of this year in content.
Thank you, Laurent. As Laurent just announced, this is the part that maybe most of you are connecting to learn about. This is where we are going to talk about the 2024 work program. It includes 7 calls, 7 topics. But before I just go into those details, I'd like to just say a few words about our strategic approach, which is in a way the guidance when you think about the proposal you'd like to bring to us. First of all, our vision is to reduce the individual suffering socially, economically, caused by poverty-related diseases in sub-Saharan Africa. And this is something which is done in collaboration between researchers based in sub-Saharan Africa and Europe, but also those who are outside those two geographical areas I just mentioned. In terms of the mission, we are looking at accelerating the development of products, diagnostics, vaccines, treatments, but it's also not only bringing new ones to the market, but it's also improving those that are existing already on the market. Now, we do have to advance, of course, biomedical research, but to be able to advance biomedical research, we do look at capacity strengthening efforts that can be done by ourselves together with our partners, but also insist on the networking element where those who are maybe working in isolation can do better if they work with other partners from other parts of the globe. Now, as some of you may have seen, in terms of research and innovation priorities, we do have a list of target diseases. It is not only the diseases which were in the first program, but as you can see, for example, the NIDs category has included a longer list, not the full list of WHO NIDs, but we do see that it's those which are common in sub-Saharan Africa. Quickly to that work program 2024. This is a work program which was adopted by a governing board back in December, on the 15th of December 2023. It includes, I was talking about 7 calls, but 2 calls covering 7 topics. Next to these 7 topics, we also have a provision to mobilize funding for research in case of public health emergency. That has to, if it happens in the coming 12 months. And the total budget, as indicated by Michael in the beginning, is slightly more than 140 million. The 7 topics that I mentioned, one will be covering HIV therapeutics, 22 million. We are devoting 30 million to malaria vaccines, and we are putting 22 million to NTDs, 24 million to AMR through R&D in novel and existing antimicrobials. There will be 18 million going to vector control, 20 million going to digital health solution for sub-Saharan Africa, and there will be a new type of fellowship, which we are calling now the fellowship with the return phase, 3.5 million, which will be done together with the industry partners. And not to forget that there's 1 million which will be kept aside for to intervene if there is a public health emergency, if there's an outbreak in sub-Saharan Africa. Moving on to the very first topic that I mentioned, developing novel, innovative HIV therapeutics for reducing the disease burden of HIV in sub-Saharan Africa. Just to indicate that this will be a research innovation action, as you all know, if it's a research innovation action, there has to be a clinical study component, and we expect the project size to be about 5.5 million. We are looking for a project that will generate evidence of efficacy, safety, and clinical utility for professionals, clinicians in sub-Saharan Africa, those who are working with the patients using existing therapeutics, but are always looking for improved regimen combinations that are safer and more efficacious in terms of giving a chance to patients to live longer and live, maybe reduce comorbidities when they are HIV positive. We're also looking at projects that will innovate, look at what we have in the pipeline, but also what can be combined based on what we have already on the market. Out of these outcomes, we're looking at projects that will address at least 2. But it's also that we do have always this scope, which includes, it's a guidance on what you should be putting in your proposal, but we also insist that in the context of planned clinical investigations, there should be identification and validation of biomarkers for better optimization and personalization of HIV treatment decision, as well as more accurate predictors of progression towards AIDS. This is from the observations or earlier research that has suggested that there are differences if you look at patients. Of course, we do have a lot of patients to take care of, but if research from this call can help us identify biomarkers that can inform clinicians in terms of deciding better which combination is better for which patient, that will be a good outcome from this call. Now, moving on, I will pass to my colleague Lydia Boudaren to talk a bit about the malaria topic.
Thank you very much, Jean-Marie. So indeed, the next topic is on malaria. If we can have the next slide. So here again, this is a research and innovation action with an overall budget of 30 million euros. Here the size of each project will be slightly higher than the other topics, as we expect projects of around 15 million euros. So this topic really aims to accelerating the registration of new vaccine candidates, but also generating long-term safety and efficacy data of currently registered vaccines. In addition, we would like to also see a generation of safety and efficacy results from other vaccines, which are targeting the whole life cycle of all the stages of the life cycle of Plasmodium falciparum, including the current candidates in phase 2A and B. In addition to that, we would like to also see the generation of evidence-based recommendations to boost manufacturing and also increase the efficiency of supply chains for vaccines in general, but really with a strong emphasis on malaria vaccines. So if we go to the next slide, when it comes to the scope for this topic, as I mentioned, the idea is really to advance the knowledge on this, knowledge and the evidence on the safety, efficacy and effectiveness of current or new malaria vaccines. And the proposal will have to address at least two of the following points. Proposal will have to either suggest trials from phase 2A to ensure that there is continuation in the research and development pipeline for generation of new vaccines against malaria. We would also like to see long-term effectiveness studies, if possible, with aligned primary endpoints for the studies. And finally, we would like also to see collection, analysis and sharing of pharmacovigilance data for vaccines which are currently registered or which are candidates in later stage of the studies. So the idea is really to have at least two of these points addressed in the proposals. And I hand back to Jean-Marie for the next topic.
Thank you, Lydia. Now we'll tackle the NTDs. Most of you are used to NTDs being introduced in EDCTP2 back in 2015-16. But now we do have NTDs as part of the program from the beginning, but also hopefully with the larger investments compared to the previous program. If I can have the slide. As mentioned earlier, this will have a budget of 22 million. And we expect project size to be around 5.5. So we're looking at a topic which will accelerate the development and integration of therapeutics against NTDs in sub-Saharan Africa. Now, in terms of expected outcome, at least two of the listed that you can see on this slide, but we have to insist again that it's about accelerating development of therapeutics towards the registration to make progress in the control and elimination of NTDs in sub-Saharan Africa. It's also to be able to improve the understanding of barriers for progression of existing and new therapeutics against NTDs. As we know, the R&D pipeline for NTDs, in some cases, it's busy. In some other cases, it's almost empty. So we're looking at the strategies where we can maybe feel where we are missing, where we have gaps. But if we have a chance of a product that is approaching the end phase of the pipeline, to be able to bring it to market. EDCTP2 has been able to bring a few products close to registration, or even to registration, or better combinations to registration. We are going that line, looking at that long list of NTDs that are in Africa to get at least a few products registered, but also not forgetting integrating these therapeutics in the strategies that countries are putting down using maybe health research results generated by you, the researchers, whether you are based in Sub-Saharan Africa or outside. So this call is really not only to register these products, but to help national programs integrate them better in the intervention strategies that they have. Now, it is, of course, always to be reminded of the NTDs in the scope of our program. I will not go through that whole list, but just to indicate that if you are used to the long list of 20 NTDs as according to WHO, we've removed a few which are probably not prevalent in Africa. And some of you may have asked questions earlier about other, for example, snake bites, if those are elements which are covered in our NTDs. Those are out. We specifically display this list for you just to take note. and see what is in our scope. So the proposal we're looking for should aim at delivering results that contribute to at least one of those bullet points you see there. And then again, it is something that we are going to be repeating a lot. Clinical trials on therapeutics, but also working on existing therapeutics, looking at what is in the pipeline, whether you repurpose a therapeutic product or whether you push something from the pipeline from phase 2 to 3, or from phase, if there is already phase 3, to be able to bring it further to registration. Now, as I move on, I'd like to remind you that there is a QR code on the screen which you should be able to use to post your questions, which we'll be able to address later. But for now, I'll pass again to my colleague Lydia to talk about the AMR topic. Lydia, over to you.
Thank you, Jean-Marie. So indeed, the next topic is on AMR. Here again, this is a research and innovation action with an overall budget of 24 million euros. And each project is expected to have an overall funding of 6 million euros, more or less. When it comes to the expected outcomes, we really expect an improved use of antimicrobials to reduce the resistances, and also to provide data to increase the equitable access of antimicrobials in sub-Saharan Africa. In addition, we would like to have an improved advancement of the late-stage clinical trials research and development of novel antimicrobials. So the idea is to have one and or two of these objectives tackled. And in addition, we would like this topic to achieve at least one of the following points I will describe. So the first one would be the generation of data to develop and implement antimicrobial stewardship using a One Health approach, or to implement effective prevention control measures to really reduce the need for the use of antimicrobials in antimicrobials medicines. So if we go to the next slide. So when it comes to the proposal itself, the scope of the proposal will have to include research focusing on existing and or novel antimicrobials from phase 2 onwards. All products previous phase 3 will not be eligible in the scope of this call. We strongly really encourage the proposal to include work across different sectors and actors, including human and veterinary medicine, agriculture, finance and environmental aspects. We also strongly encourage you to include industry partners in the consortium, and the scope also includes sepsis. So any studies on sepsis will also be eligible for this topic. And Jean-Marie, I hand back to you for the next topic.
Thank you, Lydia. We'll then talk about vector control now. This is a topic which many of you probably were positively surprised to see this topic being listed, because the two previous programs, EDCTP1 and 2, were not including vector control in the funded work for reasons that maybe were due to budget reasons or the strategy of back then. Vector control studies were not as part of the portfolio of EDCTP1 and 2. This is the first time that EDCTP as a program, the third program now, invests in vector control. So this will be looking at new tools, technologies and approaches for vector control in sub-Saharan Africa. Now, as mentioned earlier, this will be slightly higher than 18 million budget devoted to this topic. We are expecting projects that are about 6 million in size if you look at the value of each individual project. So here, maybe I'll just look at first at that the lower line of this slide. These are the diseases in our scope. So we've looked at diseases which involve vector. So it's chikungunya, dengue, LF, Rift Valley, yellow fever, schisto, onco, plague, leishmaniasis, CC, HV, HF, sleeping sickness, and malaria. These are diseases in our scope first, but also with a vector that could be controlled. So we look at projects that should aim at delivering results that are directed, tailored towards and contributing to the development and evaluation of tools, technologies and approaches for vector-borne diseases, including vector control and also disease management technologies. These are questions that have been maybe a priority for national programs that look at each local issue and address it with the means they have. But here, we do want a call that will help us generate data that can be used by Ministry of Health or other national programs that intervene against these diseases. They are not all across sub-Saharan Africa, but they are located. So we are expecting a topic that is going maybe to look at chikungunya prevalence in XYZ countries and bring proposals from those specific places. But also, if you think of sleeping sickness, for example, we've heavily invested in therapeutics, but where countries are looking at other measures to take control of the disease and, if possible, eliminate it, there is need to have tools to control the vector, not only when the disease already passed to the human individuals. So this is really that call which will complement previous investment, whether it's in diagnostics or treatments or vaccines where they exist. In terms of scope, so it's a long list of interventions that could be thought of. So it's vector traps, genetic manipulation, sterilization agents. I will not go through the whole list, but if you go at the end of that slide, you see improvements in housing, urbanization, monitoring and surveillance tools. These are some of the questions which are not, let's say, the typical issues that we address in studies that we fund. But as I mentioned, this is a new area that EDCTP as a program, now EDCTP3 has thought that to complement previous investments, we do need these tools, we do need evidence-based informed decisions if we have to help countries decide better, not only maybe things which are based on empiric research, but also to have real scientific data that will help countries, for example, decide on which ITN is to be used in which community. So this is to be able to say, not only we, the funders, but also the policymakers, WHO, to be able to have data that will inform those programs which are maybe in some cases not necessarily working with the traditional clinical researchers. I'll move further to a call on topic and over to Lydia now.
Thank you, Jean-Marie. So the next topic is on digital health solutions. So it's true that we have been funding several components of digital health within other topics, but for the first time we are very happy to launch a call specifically on digital health solutions. So here again, this is a research and innovation action with a total budget of 20 million euros, and we expect each project to have a budget size of more or less 6 million euros. And here the idea is really to develop, improve and or scale up digital innovative solution that will support clinical trial research, but will also accelerate the development of preventive therapeutic or diagnostic interventions. In addition, in the long term, we hope this solution to really bring a contribution to strengthen health systems in sub-Saharan Africa. We also expect the digital solutions to notably, but really not exclusively, to improve the development, production and access to health countermeasures. And we also hope that this solution will really bring efficient ways to share data with policymakers to make sure that policies are informed by evidence, but also that clinical guidelines will be also improved by the generated and shared data. What is very important for this call is really to make sure that any proposal is anchored within the digital health strategies, either of specific countries or broader regional digital health strategies. So when it comes to the scope, we really expect proposals to target demonstrated medical needs in sub-Saharan Africa and really justified context-specific needs. Obviously, all these needs will have to be part of the EDCTP3 scope. In addition, we would like to see the development, improvement and or upscale of solutions with very strong involvement of end users and health services which will use this solution at an early stage of development. It will be really important that any solution which is proposed is integrated and interoperable with existing solutions at national, regional or global level. And all tools will have to abide by the rules of accessibility, open source. They will have to be evidence-based, but also they will have to follow the standards of data protection and of global public goods. We really would like to have also a strong sustainability strategy proposed within each proposal. We would really like to avoid having a duplication of pilots, which will lead to a higher fragmentation of the digital ecosystem. So really the sustainability strategy will be an important point, but also we would like to see in the case of new tools a strong justification for the need to develop new tools and the reasons why the existing tools do not meet the expectations. In this case, we would also strongly encourage to have scoping studies as in the initiation phase of each project to make sure that the solution proposed is really viable, integrated into the ecosystem, and that can bring real added value. So, Jean-Marie, over to you for the last topic.
Thanks, Lydia. Now, as you can see now, there is the key word here is fellowship. Fellowship. This is a Global Health EDCTP3 training fellowship with the return phase, insisting on the return phase. So some of you actually may remember that for EDCTP1 and at least mainly 2, the word fellowship was almost on the identity card of the program. There were a lot of types of fellowships which were launched by the program, whether it was targeting junior, mid-career, senior researchers. So that at this point in the 3rd year of implementation of EDCTP3, we're coming up with different types of fellowship. And this is one. It will be a 2-stage. You are used to this terminology. Maybe what I should point out is I do see a small error on this slide, which I just saw a few minutes ago. It is not a research and innovation action. It will be a CSA, a coordination and support action. So in this call, there won't be clinical research, it will be training. So this is before, when we post these slides on our website, we'll make sure that is corrected, but just to point out that it will be a CSA. So it's 3.5 million. Each project is supposed to have 300,000 euros, but it is not a project size that we're talking about. We'll explain later. This will be a support to a third party, which will be receiving funding to carry out the training. So this topic is expected to be implemented with the contributions from what Laurent was explaining, the contributing partners, in this case, pharmaceutical companies that are now in discussion with us on how to be involved in this call. And as you may have seen, this is a 2-stage which is launched without naming those pharmaceutical companies, because they will join later. When you get into the 2nd phase, you'll be coupled with the pharma companies that will join the topic. So really, we are expecting proposals to implement master's level training in disciplines that are relevant, of course, to our own strategic research innovation agenda, providing transferable skills, fostering innovation, also areas of entrepreneurship, including commercializing results, but also IP rights issues, communication, public engagement, and citizen science. So those skills which are not typically coming in the other calls that we mentioned earlier. So this training is expected to be provided by academic institutions, but then complemented by training modules provided by the companies I was mentioning. Now, it's a long list of maybe what we're looking for. So the proposals, the training really should address the whole R&D value chain from preclinical to clinical research, including pharmaceuticals and vaccines. And proposals must demonstrate a few things which are maybe going to give us excellent research, excellent projects to support. So there should be a high quality training program outlined in the proposal. There should be an explanation of how open, fair and transparent the procedure of selecting the future fellows will be. And this should not neglect or forget the geographical balance within sub-Saharan Africa, but also important gender balance when you recruit the future fellows. So we're looking at proposals that will design a program where training for each fellow includes what we're calling the first phase, or you may call it an outgoing phase, which will be a minimum of 12 months, maximum 24 months, where the fellow is enrolled in an academic institution. And then the second phase, what I was calling the return phase, of at least 12 months back in the country of origin or at the institution of origin of the fellow. A robust training and mentorship mechanisms to be explained in the proposal, but it's also, we're looking at proposals that will make sure there's linkages with other EDCTP3 actions. Here we gave these examples, the Global Health EDCTP3 training networks, which are from our previous work program 2023, but also the EDCTP3 genomic epidemiology networks. If you wish, this list could have been longer, just the examples, but we also are looking at a training program that will link to other previous programs where EDCTP2 has invested maybe in networks of excellence or maybe in epidemic preparedness networks. If those can be the providers of the training in a supporting context, that will give value to the investment that are made by this organization or by the previous ones. Now, maybe I'll come back to that later when we get to the Q&A. It's just to mention again that here we're looking at companies that will co-give the training. They are not going to co-write the first proposal with you, but they will join in the second phase. But that is to be clarified when you proceed towards the second phase if you were successful. Now, there may be questions about applications and evaluation process and timelines, but I will pass to Lydia to explain a bit how this will be taking place this year.
Thank you, Jean-Marie. So as we have just discussed, all the topics that we have presented are two-stage topics. So the way to proceed is in two phases. So the first stage will consist in sending an application with a short outline of proposal, and this proposal will be not more than 10 pages and will lay out really the structure of the proposals you are submitting. So at this stage, only the impact and excellence of the proposal will be evaluated, and the ranking of the proposal will be really based on the scoring of each of those two criteria. Following the ranking, we will be selecting for the second phase a set of proposals which will cover more or less 3 times the overall budget of the topic, and you will be invited, if successful, to submit a full proposal during the second stage, and there it will really be a comprehensive proposal which will be evaluated against the implementation excellence but also impact criteria. So there again we will be doing the evaluation in an independent way, and the ranking will be really based on these 3 criteria of excellence, impact and implementation. So when we look now at the timeline and the deadlines, which is also very important, if we go to the next slide. So as Jean-Marie said, the work program was approved mid-December last year, and we have published all the topics on the 21st of December. We have opened all the calls on the 18th of January, so you can see all the details in the funding and tenders portal and the EDCTP3 website. And for the first stage for each topic, the deadline will be on the 4th of April. Following the reception of all your outline proposals, we will conduct the evaluation in April and May, and we will have the approval of the shortlist in June, and you will all be informed of the outcome of the evaluation early July 2024. At that point, you will be invited to submit the full proposal by mid-September 2024. And we will proceed with the evaluation in October and November, including the approval of the outcome of the evaluation. And you will be receiving the result of the evaluation early December 2024. So if we go to the next slide. So we have now explained all the specific topic, the open calls for proposals. But as Jean-Marie mentioned at the beginning, there is also another action which is not subject to calls for proposals, which allows to mobilize funding for research in case of public health emergencies. So again, this is really not a call for proposal. This will really be triggered in case there is a health emergency which is declared, and there will be an overall budget of around 1 million, which will be unlocked in order to advance the research for a specific topic. So the research will have to contribute to the impact of this work program 2024, and it will allow the Union and Sub-Saharan African countries to really respond to the public health emergency in question. And this funding will really allow to accelerate the research to respond to the outbreak. So if we go to next slide. So once the health emergency is declared, this will really trigger the unlocking of this funding. And what will happen is on the funding and tender portal, there will be a specific section where this funding will be advertised. And we will also make sure from the Secretariat level that we advertise this as widely as possible. So this funding will be open to all eligible entities or to limited targeted entities, depending on the context. And the idea is really to make sure that the funding can be implemented as quickly as possible and also adapted to the specific context that we'll have to face. Another option is really to have this funding, which will come as an addition to already ongoing funding, and with specific activities which will target the needed research that was identified to respond to this emergency. So depending on the kind of emergency, we may be in a position to do a mix of all these different options. If we go to the next slide, I hand over to you, Jean-Marie.
Thanks, Lydia. So now, as I was mentioning in the beginning, we are a joint undertaking. That implies there is more than one family member. So our most important family members are the European Commission and the EDCTP Association. And right now, I'd like to welcome Dr. Jan Peller from the European Commission, who's going to talk to us about the European policy context when we talk about this current 2024 work program. Jan, over to you.
Yeah, thanks a lot, Jean-Marie. And as you say, it's for the European Commission, I can say that we're delighted to be part of this strong and lasting partnership of the EU, 28 countries in Africa and 15 countries in Europe. And through this partnership, we seek to enhance the cooperation with Africa to promote the actions to finding solutions to challenges that are global in nature, but often hit Africa the hardest. And since the EDCTP was created in 2004, we have from the Commission supported this partnership strongly, and many of you were in Paris in November to celebrate the 20 years of this amazing partnership. And the EU financial contribution to EDCTP3, which is now running, will be 800 million euros, but it will need to be leveraged and depends on contributions from the countries that are coming together in the EDCTP association from at least 400 million, and then those of contributing partners. And we heard how to access the program earlier of the same amount. And the governance of the Global Health EDCTP3 is run through the governing board, as we heard, that are jointly populated by the EDCTP Association, bringing together the countries in Africa and Europe and the European Commission. So on the policy side, on the next slide, we are basing our activities on the global health strategy that the Commission has adopted in November 2022, based on a broad consultation exercise and the lessons learned from the COVID pandemic. It contributes to the SDGs, but it's also part or a central piece of the EU Global Gateway, representing the external dimension of the European Health Union. The strategy is built on 20 guiding principles and lists key initiatives, of which the Global Health EDCTP3 is one of them. Next slide. So now one slide back. on the adoption by the Council. So now the Commission had proposed a strategy in November 2022, and last week all the 27 member states of the EU have welcomed this strategy, and particularly the 3 priorities, which are also in line with WHO priorities to deliver better health and well-being of people across the life course, strengthen health systems and advance UHC, including research, which is part and parcel of a strong health system. Then prevent and combat health threats, including pandemics, through One Health approach. And the Council also notes that it wants to expand the bilateral, the regional, and the global partnerships through a Team Europe approach. And what is a Team Europe approach? So the Team Europe consists of the European Union, the EU member states, including their implementing agencies and development banks, as well as the European Investment Bank and the European Bank for Reconstruction and Development. And Team Europe was initially put in place to ensure a coordinated and comprehensive response between the EU and its member states to the COVID-19 pandemic and its consequences. And Team Europe focus on common objectives and the most appropriate level of action, be it country, multi-country, or regional level. So if you go back one slide, it gives the overview. Now one more back. The overview now of the Team Europe initiatives that are particularly relevant for the relation between the EU and the AU partnership, and in relevance to this call. So there is from the left the so-called MAF Plus Team Europe initiative that looks to manufacturing and access to vaccines, medicines, and health technology. Then there is the Team Europe initiative on digital health that aims to accelerate health system strengthening and achievement of UHC through digital health initiatives. Thirdly, the Team Europe initiative on public health institutes that aims to strengthen the establishment and the setup of public health institutes, support their core functions, ensure regional collaboration and with Africa and Europe. And last but not least, the Team Europe initiative on health security and One Health that strengthens existing health security research structures for pandemic preparedness and response and for tackling AMR through a One Health approach. And this slide, on the references. So we have seen, you will see in the call topic text that we have included several references to the health TEIs that applicants need to take into account. So for example, on call topics 1 through 4 on HIV therapeutics, malaria vaccines, NTD therapeutics, and AMR, we asked to coordinate with the Team Europe initiative MAF Plus to show willingness to enter into technology transfer agreements with African counterparts, including the provision of patents, technical knowledge and know-how, or early engagement with regulatory or African manufacturers to support the translation into affordable products adapted to the regional markets. The topic 5 on AMR links to the TEI on health security and One Health, and call topic 6 on digital health technologies for collaboration and coordination with a digital health TEI. And on this slide, you see an overview of the partnerships that have been established. So both on the European side, the member states, the EU agencies like EIB, ECDC that have been involved, and the member states, and also the amounts that have been mobilized so far, both from the Team Europe overall and from the Commission in particular. And most importantly, the key partners that are engaged in Africa. So the Africa CDC, the Partnership for African Vaccine Manufacturing, the African Union Commission, AUDA-NEPAD, as the development agency of the AU, the African Medicines Regulatory Harmonization Network, and the African Medicines Agency, and also IANFI for Public Health Institutes, the International Association of National Public Health Institutes. So if you want to learn more about these Team Europe initiatives, there are links in the call text where you can find more information. And our colleagues in the DG for International Partnerships have also offered the email address on the bottom of this slide for additional questions that may come up. Next slide. And that's then the good news that the association agreement between the United Kingdom and the Commission towards accession of the UK to Horizon Europe and the Copernicus programs has been completed. It was formalized on 4th December last year and now entered into 1st of January, so applies from the work program of 24 and also applies to EDCTP grants. So that will mean that all researchers and organizations in the UK can participate in the program on equal terms with researchers and organizations from EU member states and are also fully eligible for funding. Of course, the UK has also committed to contributing a large amount to the programs, which are now additional and will still need to be decided how they will be augment the current programs financed under Horizon Europe. And that, of course, includes the EDCTP3 that may mobilize additional fundings, possibly also for this year. But this is a process that now needs to evolve. Also, as I mentioned earlier, that additional EU contributions depend on additional contributions from the member countries of the EDCTP3 and or contributing partners of the same amount. And there will be a launch event of the UK Association to Horizon Europe foreseen in London on 12th February 2024 and an additional outreach campaign to researchers in the UK. So that's from me. Thanks a lot.
Thanks, Jan. Thank you very much. Very helpful comments. Now, as I mentioned, we do have a second member of the family, that the EDCP Association. And today, if we are lucky, Michelle Singh will join us from Cape Town. I'm looking at my colleagues to see if Michelle is around. Michelle, can you say hello?
Thank you, Jean-Marie. Can you hear me?
Yes, thank you. Please go ahead.
Okay, thank you. Next slide, please. Hello, everyone. Good greetings from Cape Town. On behalf of the association, I will just guide you through a short presentation about our role. The association is one of two founding members of the Global Health EDCTP3 joint undertaking, representing its European and Sub-Saharan African member countries in the governing board. We are two offices, and the secretariat sits in Europe, in the Dutch office, as well as in Africa, and we are in Cape Town. Both offices play important roles in terms of overseeing governance related to the Global Health EDCTP3 joint undertaking and providing technical support in terms of implementation of the capacity development activities. Both offices play a very important role in terms of relationship management with both the European member states and the African member states and all the regional stakeholders. And we also play an important role regarding communication and outreach activities. Next slide, please. At present, can we just go back? Thank you. At present, we have, next slide, please. At present, we have 15 European countries and 28 African member countries and 2 aspirant members, Angola and Switzerland. Next slide, please. When seeking membership, countries commit to a minimum contribution of 200,000 euros, within the scope of the EDCTP program, please be aware that this contribution can be made in the form of cash, in kind, or a combination of both. Countries also commit to contributions that support the admin expenditure. These are costs related to the EDCTP Association's internal business related to participation in the joint undertaking, by which association members can make their in-kind contributions is called the in-kind additional activities. These activities are actually funded and managed by one or more of the member states, either independently or jointly, and they conduct work that falls within the scope of the joint undertaking. Some examples of this include laboratory or clinical trial research infrastructure, as well as expertise in terms of, for example, supervising or mentoring fellowships. And the final aspect relates to membership in terms of actively committing their participation in terms of observing the rights and obligations of the EDCTP Association. Can I have the next slide, please? The procedure is very short and simple, and what happens is we receive an expression of interest from a member state, and then we share the documentation. We set up online meetings to discuss any queries and concerns that the member states may have, and this is always related to contributions. Thereafter, once we have had our meetings, the member states actually have their meetings at in-country level at their local ministries, and when they are ready, they submit commitment letters to the EDCTP Association. Once it is received by the association, it undergoes a written voting procedure by our EDCTP General Assembly, and generally within a month, sometimes as short as 2 weeks, the official outcome on admittance is communicated back to the member state. Next slide, please. So if there's one message that you take away from today, please be aware that all countries can join and participate in the activities or in the calls for proposals. Countries may join the association at absolutely any time. However, for legal entities to be eligible for funding under the open calls for proposals, their respective country must be a member of the association by the time the grant has been signed. And this is typically about 6 to 8 months after the call has closed. Thank you very much. Back to you, Jean-Marie.
Thanks a lot, Michelle. At this point, I should just repeat maybe the slide or question, the QR code that you see. You can use that to post a question. But I also wanted to add on top of what Michelle and Jan indicated, that the EU Commission and the EDCTP Association are equally represented in our governing board. So those deciding, helping us shape our organization objectives are the two entities that were just talking to us right now. So before we move on, I'd like to see if questions are coming. Just to remind you that if your question is maybe already posted or similar to what is already posted, you can just upvote what is already placed in the Slido just by liking it. It's a very simple procedure which you do always in the social media tools that you may use. Just like the question, and you will see it appearing as the favorite from the public. So I remind you again, I'm here in the studio with my colleague from the legal office, Laurent Schell, my colleague from the scientific team, Lydia Boudaren, and online we still have Jan Pella from the Commission and Michelle Singh from the EDCTP Association. We'll be together as a team responding to your questions. Maybe I will then, I see already 3 questions displayed in front of me. They seem all to be related to legal issues, so I'm happy that my colleague from the legal office is here right next to me. I'll just read one question and hand over to Laurent. The first one is posted by an anonymous attendee. To be eligible, does the organization need to be legally registered in countries listed, or can it be an operations office in a country with the headquarters outside EU, Switzerland, or UK? Laurent, over to you.
Thank you, Jean-Marie. The answer is quite simple. Yes, indeed, the organization has to be registered in one of those countries. So, as I said earlier, the UK, as from the 24 work program, is now an associated country. So, in fact, organizations registered in the UK would be eligible for funding under the calls that have been launched. It is not the case of Switzerland. So, I think I can already answer the next question at the same time. Switzerland is not part of the EDCTP association, nor is it an associated country to Horizon Europe. So, organizations based in Switzerland have to come with their own funding. Outside EU, it depends, because, for example, you have countries such as Norway. There are also both associated countries and part of the association. So if you are based in Norway, you can apply for funding as well. So Swiss organization, I already answered this one. Unfortunately, no funding for those. So about the coordinator. I am not sure I understand exactly this question.
Right. The question which we see displayed, financial guidelines on funding allocation with partners, okay if Prime coordinates in one country, but most expenses are with the partners in other countries. So, yeah, it's basically a question of finance, of dispersing, of distribution of the budget. I suppose we don't have our financial colleagues here, but Laura, you can take
Okay,
it.
maybe I understand it as maybe that the coordinator of the project doesn't have most of the budget and that the big bulk of the funding would be dispersed to other beneficiaries in the project. So if I understood it well this way, this is not a problem. There is no legal restriction about how much funding goes to the coordinator or the other beneficiaries. It all has to be justified by the task they perform under the project. So of course, a coordinator always needs to have enough budget to perform its coordination tasks, also the scientific share of its tasks, but for the rest you are pretty free. It's all about justifying it properly in your proposal.
Yes, thanks, Laurent. No, that's clear. It depends on you when you construct the project and how you distribute that funding, but it has to be in line with the described scientific work. So one can justify the budget based on the tasks allocated to a beneficiary. So again, keep upvoting the questions if you see something that you like, that you'd like us to give a priority in answering. Questions may be a long list, but we'll just keep track on what is popular. The next one, eligibility in 3 countries, 1 from EU member state or associated, 1 from Sub-Saharan Africa. The third one can be established in either. Laurent again.
Indeed, in either, and just to be a bit more specific, Sub-Saharan countries that is member of the EDCTP association. But yes, the third one can be established in either indeed.
Thank you, Laurent. Now I see more questions coming related to almost this issue. The next one is good morning. Thank you. Good morning. Is Italy a member of the EDCTP association? Can Italy apply for this grant? A quick answer is yes. Italy is a member of the association, but also a member of the European Union. So Italian researchers are eligible for these calls. I can see the next question. Right, maybe I'll pass this to Lydia. Can you give a practical example of scientific project leadership? Is this a legal obligation? Maybe the first part, Lydia, you can help us with a few examples.
Sure. So as the coordinator of the consortium has to be based either in an EU country or in a country with a science and technology agreement with the European Commission, then this coordinator will have the financial distribution task. But when it comes to the scientific project leadership, any country of the consortium which is based in Sub-Saharan Africa and part of the EDCTP association will have the possibility to really lead the science of the project. So, for instance, if a beneficiary is based in Kenya and the coordinator is based in, let's say, Germany, then the Kenyan entity will lead all the science, whereas the German entity will really coordinate the administrative work and the financial distribution of funds. And on the legal obligation, I hand over to you, Laurent.
Thank you, Lydia. Indeed, it is a legal obligation as long as the coordinator is not based, to put it short, in South Africa. Just a little detail also to add that scientific project leadership means that does not mean that the entity submits the deliverables or the report. This is still done by the coordinator, but the scientific project leader helps to assess and checks the quality and so on of these deliverables and report. So it is some kind of formal leadership that is also still remaining within the coordinator, but on substance, the scientific project leader takes the lead.
Thank you. Next question. Do all three organizations have to be academic institutions? No, it can be a mix of academia, industry, profit, non-profit. The requirements is just the geographical location where they are registered. Those areas we mentioned, EU, associated, or Sub-Saharan Africa. So they can easily be just academic or SMEs. It's not a requirement to be only academic. Next question, an organization registered in the US, hosted in Kenya, will it be eligible for funding? This is, there's maybe a clear example of where this question is coming from, but I will hand over first to Laurent.
Thank you. In this case, I think we would have to understand exactly what hosted in Kenya means, legally speaking. What is important is where the legal entity is registered. So I know that in some cases you may have entities registered in certain countries that has offices in others. The legal construct depends on the circumstances at hand. So we will have to see case by case. But at the end of the day, registration in a certain country is what counts. So this is to be assessed in the actual situation.
Yes, thank you. And maybe what I can add to that previous question is that there are cases where the mother organization is outside Sub-Saharan Africa and there is an office registered in Africa. What is important is if the scientific input is coming from that bigger global organization, it's good value for the project. And if legally there is a possibility to have an office in Sub-Saharan Africa which is eligible, that is the best way for us to support such involvement in the project instead of think about an exceptional case where money would have to be going, for example, in this case, to US. Next question for her as well. Are these lump sums proposals?
No, not in our case. So we only reimburse costs our actual costs, in fact. So we don't work with lump sum proposals. It is something we may consider for the future, but this is absolutely not the case for the 24 work program.
Great, thank you. Now here comes a question which is topic specific. Lydia, maybe if you can have a look at this with me. For Call 3, the NTD therapeutics, can clinical trials conducted in the EU be included, or must clinical trials be conducted in Sub-Saharan Africa to be eligible for funding? It maybe applies to all the topics, but it comes specific for the NTDs.
Well, I assume part of the trial can also be conducted in Europe, but it's true that a component has to be done in Sub-Saharan Africa. So as long as the two are combined together, I would say that this is eligible for funding. Jean-Marie, do you concur with that?
Yeah, I concur. The only addition is that the applicants have to be informative enough about the phase. If it's a therapeutic R&D program where you have maybe things still in phase 1, proceeding to phase 2. So depending on the level in the pipeline where the product is, we can imagine a situation where parts of a program are being implemented in Europe, others in Sub-Saharan Africa. And as money can be spent within this process in Europe or Africa, but the project to score very well on that expected impact, you'll have to see if it's a project which is likely to generate data that will help Africa-based regulators to register products in the future in Africa. But it is eligible to have a study that is conducted in both. To have exclusive, just one study which is only in the EU, then I can imagine of studies that are in phase 1A maybe. In that case, it is likely to be beaten through the competition by those that will be seen by the evaluators as with higher expected impact if they are much more advanced and they're looking at efficacy in sub-Saharan Africa. So it is very much depending on the phase. But eligibility for funding, you have to be, if you are in sub-Saharan Africa or EU, you are still eligible. Next question, for the AMR call. Is research and development of accessible and affordable diagnostics for reducing ATB use and for antimicrobial stewardship eligible? So for this AMR call, really it is novel and existing antimicrobials, and including TB. But here, if the question is about diagnostics, this will, we cannot, with a clear line, say diagnostics won't be eligible. But because last year we had a topic which is in fact still open, which is in second phase, focusing on diagnostics, the call this year is specifically talking about therapeutics. So you would have to really justify the context, that the context of your project is focusing on developing novel or improving existing antimicrobials to be eligible. So, but if it's purely focusing on diagnostics, it won't be a fit for this for this particular topic. And I can imagine the context of antimicrobial stewardship relying on better diagnostics to combat AMR, but because the call is specifically to develop novel and improve existing antimicrobials and also look at new better antimicrobial stewardship strategies, diagnostics may be a bit far-fetched, specifically because those kind of proposals may have come in the previous topic last year. Next question, what is the expected duration for the different grants? So this quickly, it differs from topic to topic. You can, in some cases, we've specified that, for example, for fellowship, minimum placement is 12 months and maximum 24 months if you are a fellow leaving your home institution to a host institution. In some other cases, you may have seen where we say expected that this research can be conducted within X number of months, but it's not one duration applied across all calls. You have to read the full text just to, depending on the topic you are interested in, to see the duration we've recommended as what is the reasonable period in which we think a study can be conducted. Next question, Lydia, over to you. Do all topics include clinical trials?
Not all topics. So actually, the majority of the topics include clinical trials, clinical studies. But for example, Jean-Marie presented the CSA action on return phase fellowship, and there we are not expecting any clinical trials.
That's correct. That's correct. Thank you. Right. Is there a preference for multi-country projects? This is I guess this is related to, if I'm trying to maybe expand the thinking here, whether projects with more countries are likely to be seen as impactful compared to those in a smaller number of countries. It's not really, there's no preference. If you are eligible, you are assessed together with anyone else. And maybe one thing which you should be reminded of is these letters of intent first stage proposals, they are evaluated, as Lydia presented, based on excellent science and expected impact. Implementation will be evaluated later on in the second phase, but depending on the countries, the types of countries involved, you probably may have better scores in the second phase when we're talking about how to be implemented. But at this stage, many countries do not necessarily mean a better project. It will be the science and the impact, but number of countries plays a role only for eligibility purposes. Next question. Right. Since consortium composition might change from first to second stage, in case we add new partners, can the global budget be increased to accommodate these new needs? Laurent, This is for you.
This is a very good question because I don't have a clear answer in that. But what I can say is that probably if the budget increases substantially, there is a risk that your proposal for the second stage is not really anymore in line with what was evaluated in the first stage. But besides that, I think we should answer to you a bit later to have a bit more security about what we will tell you.
Yeah, thank you. Next question. For a new organization that has never participated in EDCTP programs, how do I find partners? Is the partner matching assistance available? This is a question which comes every time. That's why maybe you see me smiling. There is a matching assistance tool in the tool that you use to apply. But I have to say, these projects are always born out of your existing collaborations. But to be eligible, I can understand that in some cases you would like to have assistance in finding partners, suitable partners. So there is, if you have an account in the European funding portal, you will see somewhere if you scroll through the call topic, you go down, there is a funding partner tool. I'm not sure if it is really helpful, but if you are looking for a specific partner in a specific country, I think you can search based on the type of organization, based on the country they are based, whether it's academia or industry. But it is. I have to say, I'm not sure if it is used a lot, but since it is built in there, I just recommend you to scroll through when you read the call text in the FT portal to see that funding partner tool to see if it is helpful for you. But the other recommendation, I'd say, we always mention the previous programs, EDCTP 1 and 2. They've built these networks of excellence, other poverty-related diseases research networks, or epidemic prepared networks. There is also a very large EDCTP2 supported alumni of all the fellows that were supported by EDCTP who are now, they used to be junior, but they're now senior established researchers. Those are also maybe good sources for you to find a partner who is able to co-prepare a proposal to EDCTP. Next, for contributing partners, are you anticipating having new contributing partners in place for this set of calls, or are these discussions for future calls? Laurent?
Well, as Jean-Marie mentioned a bit earlier, we are expecting industry contributing partners to get involved in the fellowship topic. So indeed, we are expecting some contributions already for this work program. There are discussions at the moment for what we will do in the future as from the next work programs. But in any case, it's still possible for any entity participating in the projects to become a contributing partner before we sign the grant agreement at least. And in fact, get involved, do some work as part of the project without being reimbursed only partially, and then generate in-kind contribution to the JU. So it is in fact still open also for the 24 work program.
Thanks, Laurent. Now, next question, also for Laurent, I think. Can a legal entity with the headquarters in the EU be the coordinator and the country office in Uganda the scientific leader?
Yes, so I mean, this is a construct we can, in fact, yes, imagine. Now, I would just like to give a few details on that. First, we need to be sure that there is a legal entity registered in Uganda, but in principle, this should be okay. Typically, when two entities are closely related, to put it short, this one is usually an affiliated entity of the other one and participates as such. But I think if we have a case like this one, we could maybe discuss having both entities as beneficiaries directly, but it's still to be confirmed. But the general idea, yes, would in fact work, yes.
Thank you. The next question, if I may pass this to Lydia, related to the malaria call. Is it a requirement to submit a full clinical protocol for this stage 1 out of the 2 stages?
Thank you for this question. Well, as I mentioned, for the first stage, we will really evaluate the impact of your study and the excellence. So we really recommend you to provide as much information as possible that will prove the impact and the excellence of your study. We may not need the full details of the actual protocol, but the more information you can give to prove the impact and the excellence, the higher chances you have to be eligible for the second stage.
Thanks, Lydia. Next question. Do you offer any kind of assistance to countries who wish to join the EDCTP Association? I hope Michelle Singh is still online. If Michelle, if you hear me, if you can answer this one. Do you offer any kind of assistance to countries who wish to join the association? Michelle?
Hi, Jean-Marie, can you hear me?
Yes, please go ahead.
Yeah. So in terms of assistance, we actually have meetings with the member states, and we guide them through the process, and that starts with actually discussing their needs and their expectations of joining the association. And we also provide examples, because some of the main questions come around support regarding the contributions, how countries can actually provide their contributions, whether it's in cash or in kind, and also we share examples of the in-kind contributions. The other assistance we provide is that we link up the member states with the potential member states with our existing member states. For example, current members of the GA who actually meet, and it's generally tailored around whether it's a French speaker or depending on the language. And so that's also very helpful. We found where countries who've gone through the process of membership guide other members through the process. So I hope that helps you.
Yes, thanks, Michelle. And I'd encourage actually those who are looking at joining the association to get in touch with the Africa office, EDCTP Africa office for guidance, because that will help you be eligible in the future. And I know these are questions which get decided at ministry level, but if the scientific community is the one to bring the idea to the ministries, I think it can be better for both sides in terms of participating in these international consortia. Thanks, Michelle.
Okay,
next question for AMR. No, this is about the first topic. Is the HIV topic suitable for a phase 2-3 clinical trial to continue an ongoing, nearly completed phase 1-2 clinical trial funded by EDCTP3? So as we mentioned, this first stage, it will be looking at excellence and expected impact. And if you are able to demonstrate that your proposal, your project is ready to go into these phases 2 and 3, independent of whether you were funded by EDCTP3 or not, you'll be evaluated by independent experts, and you can apply. No one will exclude the proposal because it has previous funding from EDCTP. In fact, if there is value in investing in continuity of a project that is promising to bring a product to the market, that is on policy level also a wish, but you will have to compete with everyone else. I hope that addresses the question. Next question. It is maybe coming from the same person or the same group. The scope of the HIV topic, which is HIV therapeutic infection. Can infection prevention also be considered in line with the scope of the call? I believe this is a question which comes often when it's about HIV funding, because we do know this is a scientific question which will have, of course, ultimately to be agreed on by our consensus evaluations by our independent experts. But because some therapeutics are used to prevent, for instance, progression of the disease, or to prevent passing of the disease from mother to child, for instance, there are therapeutics that can be imagined that will be used for prevention, for infection prevention, but not only infection prevention as in the vaccine context, but the therapeutic which is used to prevent the disease from spreading from individual to individual, whether it's vertical or horizontal transmission. Next question. Right, maybe I'll pass this to Lydia for the HIV therapeutics. Can this include treatments for opportunistic infections and or advanced HIV disease as a syndrome? or only directly acting on HIV?
This is a good question. I would say that HIV has to be central. If what you're proposing can also target opportunistic infection, and again, if that meets the impact and excellence criteria, we really advise you to submit the proposal with a comprehensive scope.
Yes, thanks, Lydia. Guess topic 1 is very popular. The title shows developing novel, but the scope shows late-stage trials. Can you confirm the call is not about developing drugs? So, of course, there are those key words that you picked: developing novel, late-stage trials, and we do insist that this program, it's a program that's going to exist until 2031, and one of the key goals, one of the most important goals, is to bring products to the market. But in cases where there are existing interventions, we're looking at improved ones. So it both apply. You can imagine a situation where there are new candidates on the market which have to be progressed in the pipeline. So that will still be developing new drugs, but not necessarily in the discovery phase. But there are products that are probably already somewhere in the pipeline that we have to advance. And where we talk about late-stage trials, it is because we are eager, we are really hungry, would like to receive proposals that will help us bring products to registrations. It does not exclude developing novel. If there is something right now in phase 1 and is promising and can demonstrate that there is excellence and good expected impact if they move in stage 2 or 3, that will be part of the developing novel. And if there is something already in phase 3 close to registration, it's a late stage which will also help us within the few years come bring that product to the market. I hope that addresses the question. Next. As I see, some of you keep anonymous as the question poster, but others put the name. I see Dario is the one posting this question. Good morning, Dario. In call developing novel HIV therapeutics, which phases of clinical trials are excluded in definitions as advanced stage and the late stage? Lydia, back to you. Maybe you. So it's again on HIV. We talk about these advanced stage or late stage. We do not necessarily put the definitions, but Dario's questions about which phases of trials are included or excluded in the definition of as advanced or late stage.
I guess that's what you have mentioned just now. The idea is really to ensure that we have as many projects as possible that reached registration. So obviously we cannot include phase 1 maybe trials, but as the latest the stage is, the better it would be in terms of reaching the impact of EDCTP3 program.
Thanks, Lydia. Again, on HIV topic, can HIV co-infection, opportunistic infections, example, crypto meningitis, be considered for funding and not only HIV IRVs for call topic 1? Yes, this is, I think, it's been covered. Co-infections, opportunistic infections in HIV. One example is clear cryptococcal meningitis has been also in its P1 supported as part of HIV co-infections research. So this is eligible for funding. Thank you. Next question. Good morning, Miguel Avarero from Spain. Thank you. Dealing with innovative digital health, must the digital health solution be only covering infectious diseases? Lydia.
Thank you for this question, Miguel. So actually, the digital health solution have to be within the scope of EDCTP3. So the main focus will be infectious diseases, but as you will see in the strategic research and innovation agenda, non-communicable diseases can also be integrated, for instance, as part of a study on infectious diseases. So we could imagine a solution that would target NCDs through infectious diseases. We also have few novelties compared to EDCTP2 in the EDCTP3 strategic research and innovation agenda, which includes, for instance, climate and health. So this could also be an option to target digital health solutions. So really, as long as it remains within the scope of the strategic and research innovation agenda, this should should be eligible.
Thanks, Lydia. I think the next one is also for you. For the digital health solutions topic, would an e-mobile health application be eligible for funding under this topic?
Sure. So again, an e-mobile health application could be eligible as long as it is duly justified and it meets all the criteria we have presented early on. And again, we would need to have a strong justification and maybe even a scoping study to really confirm the need for such solution. So yes, that kind of solutions would be clearly eligible as long as it's duly justified and meets all the criteria.
Thanks, Lydia. Yes, innovative digital health solutions is also a popular topic. Are the innovative digital health solutions expected to tackle specific communicable diseases, or are more horizontal packages such as rehabilitation interventions for a broader range of diseases and disabilities? Lydia, back to you.
Thank you, Martin Jacobs. We are not specifically targeting communicable disease. What we are expecting is that any solution targets really high identified needs in sub-Saharan Africa for specific communicable diseases, and that your action is duly justified. So as long as you can justify the high needs, then a more horizontal package would be clearly suitable.
Thanks, Lydia. Thanks, Lydia. The next question is on the vector control. For the vector-borne call, do the projects need to cover more than one vector control approach, or would a project on just bed nets be eligible for funding? So again, the idea is that for the first stage, we evaluate excellence and the impact, expected impact. Depending on the disease you are addressing, probably more than one will give you a better score on expected impact. But to answer quickly your question, you are okay if it is just one intervention. If it is one control approach which is in the proposal, it's eligible. Again, is the vector control call, in the vector control call, what would you consider novel? Would an existing phase 3 trial on the concept exclude it, even if not yet enough evidence for tool? So the definition of novel or innovative, if it's not yet already on the market and there are evidences suggesting that it's a promising product that can be once registered, it is still novel. So the fact that it's not yet on the market does give it a chance if there is still R&D ongoing. So you do not, depending again on the disease we are talking about, we are not going to say this is excluded as a tool or not, but you have really to think about the excellence and the expected impact. If it's a repeat of strategies that have been trialed before, our expert members will, of course, see it as a me too, a repeat of something, and there will be in the competition probably other more novel than what has been done before. So it's you have also to look at the context of the disease and the strategies that have been trialed before. Thank you. Next question. For the fellowships topic, companies will join the consortium at a later stage. When? Do they need to join before the submission of proposals, or at stage 2, or at grant agreement? Does the consortium need to look for such a partner, or is it EDCTP that will look for them? Thanks for the question. This is a very specific question. The answer is you as an applicant for first stage do not have to look for a partner. What we mentioned that these companies will join at a later stage, this will be done at our level. Once you pass the first stage, I will not use the term of forced partnership, but we will bring to you, we'll introduce to you the pharma company that will be working together with you in a second stage application. So this will be on our side, and you do not have to co-write the first proposal with any other company. It will be at stage 2. So you have to pass the first stage, and we'll introduce to you the pharma company joining you in the second stage. Next question. On the fellowship call again, it depicts fellows will get international credentials. Does this mean collaborating with international academic institutions only? No, the term international is maybe could be misleading. If one moves from Congo DRC to Congo Kinshasa, to Congo Brazzaville, it's also international. It does not have to be. There's no such a club which we classify as academic institution being international than others. It just meant that there will be an element of moving from one place to another. In some consortia, you will have maybe more than 2 countries, and fellows can move from one country to country, or from the country to the pharma company, which will be in the call. Again, in the program Global Health EDCTP3 Training Fellowship with Return phase, is it at MSc? No, it was specific in the slides. It is master level, just to be short in the answer. Master level, MSc. Next question, for the CSA topic on fellowships, does the master program need to be an officially academic one, university, or the postgraduate level training program would work? One clear thing is that there have to be a master degree awarding program. The nature of the academic institution or training institution does not necessarily matter. There have to be a provision that one is legally allowed to award these degrees. Next question. Maybe I'll pass this to Lydia. Let me see. For the project on the vector-based diseases, would a combination of UK with Cameroon, or maybe it's Laurent, it's legal. First I thought it's science, but it's legal. Would a combination of UK with Cameroon, DRC, and Kenya be eligible? We were told we have to have another EU partner.
Yes, so in fact, this construct would work simply because now the UK is an associated country. So what you need to have in your consortium is 3 entities from 3 different countries where the entities are eligible for funding. One in sub-Saharan Africa, in a country that is member of the EDCTP Association. So this I can see you would have it with the countries, the African countries that you mentioned. And the other one has to be either based in the EU or an associated country. And it is now the case of the UK. So in fact, you could do without an additional EU partner. And what you're proposing, the 4 countries you're proposing, is absolutely fine.
Thanks, Laurent. I think that's a good relief for many. On the digital health, Lydia, is it eligible to have an innovative approach that integrates a digital health innovation with health service innovation?
Thanks, Konstantinos, for this question. So this is quite broad. Indeed, having a digital health innovation with health service innovation would meet the need to strengthen health systems down the line. But we have to make sure that this would also meet very specific needs and meet the criteria of the call. So we would need to discuss a bit further to see if this fits within the scope.
Thanks, Lydia. Well, someone is indicating that we said sepsis is included in the AMR calls. However, with sepsis research one of the challenges has been the lack of a single drug. Is mechanistic research okay, or how do you expect sepsis to be tackled? So specific to this question, we are aware that sepsis has been actually an issue when we look at one single drug. But this particular call, does not exclude combination of drugs. Whether I say it's a regimen of multiple or a fixed dose combination, we are open to any innovative idea that can address sepsis, whether it's one single drug or a combination. So if that is your question. So it is okay to have multiple existing plus novel ones, or just new recently discovered molecules are also eligible if they've passed the safety phase. So it is not. It would not mean that we look for just one single drug. You can use a combination. Next question. For the AMR call, is it possible to propose only on the aspect of the environment? So I know we've indicated that the One Health approach is encouraged under this call, but it is important that there is a human element. It cannot be a proposal focusing only on the environment. We have to stay on our mission where we talk about developing tools that will help us reduce the burden of infectious diseases. And I understand the element of environment research, but the human health has to be the center of the proposals. Next question for Laurent. Can you explain again the purpose for the letter of endorsement to become a contributing partner?
Yes, thank you, Jean-Marie. So the purpose is like mostly to outline what the contribution of the potential contributing partner would be. So both in terms of science, in what field the collaboration would take place, in what topic in the entity would be involved, also the amount of the contributions. So depending on the case, this is to be discussed with us informally first. We would see how much level of detail we would need in this letter. So this is really to be assessed case by case, but the overall idea is that you explain well how you would get involved and what type of contribution and how much. And then the ultimate purpose is that the governing board approves you as a contributing partner in the joint undertaking. So this letter of endorsement is ultimately submitted to the board, and then this leads to a decision of the governing board about approving or not. Then, of course, in practice, what we want to do is to make sure that if you submit one, you will be approved ultimately. So we will prepare the ground together and see if there is really an area of interest between the JU and this contributing partner.
Thanks, that's clear. Thanks, Laurent. Next question from Dr. Solomon. Does the program support primary drug discovery research to come up with a new therapeutic agent against NTDs? Thanks, Dr. Solomon. The answer is short. We do not support anything preclinical. We support when a therapeutic agent or any intervention has entered phase 1, has entered clinical research. So if there is any promising product that you are working on NTDs and it's still preclinical, there may be other sources of funding, but for us it is only when it has entered the clinical phase. Thank you. Next question. For the NTD treatment call, are only late-stage trials leading to registration eligible, or can early-stage clinical trials be included with a plan for registration? Good question. I know we insist on the late-stage trials, but good promising candidates, if they are still in early stage, they are still eligible. And what you mentioned at the end, inclusion of a clear plan for registration is always good to have in a proposal, though this will be short outline first stage. If you believe you are still early stage, it is good to outline that path to registration as part of your demonstration of excellence and expected impact. Next question. Can only African countries from Sub-Saharan Africa join the EDCTP Association? Maybe Loha will give you this question.
Well, I would like to answer to you, but I wouldn't like to speak on behalf of the association itself. So maybe Michel can help. This depends on the status and the approach the association has. So I would prefer to revert to Michel.
Michel, if you still hear us, can only African countries located in Sub-Saharan Africa join the association? I know at the forum some have come with the question whether the North African countries can join the association, but maybe you have an answer to this.
No, actually, just the Sub-Saharan African countries. Can you hear me?
Yes, thank you. So it's only Sub-Saharan Africa. I think for reasons that are maybe related to disease prevalence and socio-political, economic reasons, it has a long time ago decided that the EDCTP Association is focusing on Sub-Saharan Africa. Thanks, Michel. Next question. What does it mean that some association member states were marked in orange on the map? I'm trying to remember which map you're referring to. I think the map presented by Michel. I think that was indicating countries, the newest members. So one of the interesting changes that we've seen is that like 3 years ago, the association had, I think, 16 members from Sub-Saharan Africa. Now there are 28. So there is a quick growth in the membership of the association. And those which were marked in orange, I believe they were the newest, if I'm not mistaken. Michel, you may correct if I'm wrong.
Yeah, that is correct, Jean-Marie.
Okay, thank you.
Thank you very much. Thank you.
Thanks. Next question for Loha, I think. Do contributing partners need to appear as partners in the FT portal without requesting funds, or will they need to appear only in Part B of the proposals?
Thank you. So in this case, we're talking about contributing partners that will be involved in the project. If I understand well, that would really do some work. They are supposed to be fully, in principle, included in the proposal, and this means be fully included in the project, in the consortium, just like any other beneficiary. The difference being that they would not request total funding or no funding at all. So, in fact, we would need to have their role very, very clearly outlined also in Part A, ultimately. So they would be involved in some work packages. And we will need to have also their budget. Because even though they don't claim costs, we need to know how much they will incur in terms of cost so that we can count their in-kind contribution ultimately, in the same way as other beneficiaries. So you can consider these entities just like any other beneficiary, with the only difference that they will not receive funding, only partial.
Thanks, Laurent. That's helpful. Next question. Lydia, maybe if we look at this together, is there a preference for fundamental or translational research for the vector control call?
I would say there again, it will all be about the impact you will be laying out in your proposal. So if you have a very strong fundamental research proposal which will really provide a significant impact, then that could be a good one. Obviously, translational research may have shorter term impact, so this may be favored. But maybe just to also recall that all the evaluation will be done by independent experts, and they will really base the eligibility of your proposal on the topics text. So we really advise you to read very carefully each topic text and maybe put yourself in the shoes of an independent evaluator. When they will see your proposal, how do you think they will be evaluating it in terms of impact and excellence? But Jean-Marie, I don't know if you want to...
I think you're right. So here it will be the path to impact will actually make a difference if you are talking about fundamental research versus translational research. So the science can be excellent in both cases, but when it comes to evaluating, to giving a score to what is the expected impact from your project, maybe depending on how you are going to give evidence in the proposal, it may be that translation will give us a quick path to the solution. But it's really up to you on how you put that balance in the proposal. Right, I think time is almost up. I'm just reading that last question before I hand over to my colleague to give some closing remarks. It's about, well, let me just read out. Does the EDCTP have guidance on how to manage the balance between open access and financial sustainability when working with commercial partners? Laura, 30 seconds, this question.
No, I don't think we have any specific guidance at this point, but we can probably give some later on. Yes, we'll come back to that and to any question we haven't answered up to now.
Okay, then thanks a lot. But I guess these are very important questions to think of, especially now we are insisting that there should be partnerships with the other entities. I look at the list of questions. I think there's a last question which we can also read. What are the obligations of the participant in terms of results and digital technologies exploitation during and after the end of the project? Loha, 30 seconds.
Yes, thank you. So here I can invite you to refer to the specific conditions that are under the topic you are interested in, and there you will see a detail of the additional exploitation obligations, and these include, as I mentioned earlier, the global access plan and a stewardship plan, but there are also obligations that potentially can run after the project is finished. So we don't have time to go into details, but please have a look at these conditions, and if there are any doubts later on, we'll of course reply to you.
Super, thank you. And I'm happy to announce that we've answered the last question. This does not happen often. And then before I leave you, I'd like to say hello and thank you again. And now I hand over to my colleague Lydia for a few closing words. Lydia, over to you.
Thank you very much, Jean-Marie, and thank you very much to all of you who have attended this Info Day today. It's been a great session, and we would like to thank you for the great questions as well. We really look forward to working with you together in the coming weeks and months. So few information before closing. So we are having also another Info Day, 2 other Info Days actually tomorrow. I think we have a slide on this. we will have the Portuguese speaking info day tomorrow, which will be online. You have a link which will be shared with you. It is still time to register, so please feel free to register and to attend if you're a Portuguese speaking country, and to disseminate also throughout the Portuguese speaking networks. We also are about to have tomorrow another info day which will be French speaking, and this will be in person. This will not be live streamed, but we'll make sure to upload the recording and the answered questions online as well. So this will be made available on the website. If we go to the next slide, we really encourage you to look at the funding and tenders portal. So there is a wealth of information there, which is really useful as you go through the development of your proposals. You will have all the details of the calls for proposals. If we develop FAQs for specific topics, we will be posting them there. As I mentioned earlier, the emergency topic would be advertised there in case it is needed. And obviously, we also have the EDCTP3 website. There again, you have a wealth of information, and our communication team has been doing a fantastic job in bringing all the documents together, so you can find all our strategic documents, the work programs, the calls, but also the latest information. And finally, if you have further questions, please feel free to contact us anytime on the functional mailbox, which you can see on screen, and do not hesitate to follow us on the different social media, so you have the different links on the slides. So thank you very much to all. It's been a great pleasure to share these 2 hours with you. We look forward to receiving your proposals, and good luck in the next week for the development of your proposals. Thank you very much. Have a good day.